こんにちは皆さん。私、修二と妻のエイリーンのチャンネルにようこそ。
Some scenes on this medical documentary may be disturbing to very young audiences. Parental guidance is strongly recommended.
Pneumothorax, the definition, causes and recurrence. It has happened to me twice in a span of 5 years.
Pneumothorax is a collapsed lung. A pneumothorax can be partial or total collapsing of a lung, and it usually affects one lung. It can happen spontaneously without any warning, a spontaneous pneumothorax. And this is where you have a defect in the alveolar wall and the visceral pleura. What happens is that you develop a pulmonary bleb, and this is like a sac-like blister that develops on the visceral layer of the lungs. And what can happen is that this bleb can rupture. No warning sign. That's why it's really called spontaneous, because there wasn't an injury that caused it. It just happened without warning. And that blister ruptures and it releases air into the intrapleural space. And these blebs can develop over time. Patients can have multiple blebs, and they may not rupture immediately once they develop. Small ones tend to resolve on their own without treatment.
It was way back in 2013 when I was first diagnosed with pneumothorax. At that time, only a small portion of my lung had collapsed, and the doctor closely monitored my condition with a series of chest x-rays until the excess air was completely absorbed and my lung has re-expanded. But 2 years later, after my Japanese language class, I was brought to the hospital due to pneumothorax and was admitted on doctor's orders. What are the signs of a collapsed lung?
Patient may complain of chest pain. All of a sudden, the heart's trying to pump faster to get blood to the body because it has low oxygen level, and the body's causing the respiratory system to increase in respiration so you can take more oxygen in. L for low blood pressure. The other L for low SpO2, if you have them on an SpO2 monitor, you may notice that it would be less than 90%. A for absent breath sounds on the affected side. If they have a collapsed lung, you're not going to hear breath sounds on that side that has a collapsed lung compared to the other side. So you'd want to compare the sides, see how they're sounding. Next, P for pushing of the trachea to the unaffected side. Remember, that was in attention pneumothorax. But remember, if your patient has a pneumothorax or a chest tube, they are at risk for attention pneumothorax. So if you see that, it could be developing into that. But remember, that's a late sign. Another S for sucking sound, and remember that was in the open pneumothorax, where you have that passage through the chest wall that is allowing air to go in and out of the lungs through that opening of the chest. You're going to, of course, be monitoring the breath sounds. What do they sound like on this side compared to the other side? And you're going to be watching the rise and the fall of the chest. You're going to be monitoring their vital signs, especially their blood pressure, their heart rate, their respiratory rate, and their oxygen saturation. Another biggie is maintaining that chest tube drainage system if it is placed by the physician. A patient with a pneumothorax, you would want to make sure while you're maintaining the drain that you're assessing for leaks in the system, the chest tube drain system, and make sure it's working appropriately. You may have intermittent bubbling in that water seal chamber as the air is escaping, but excessive bubbling in the water seal chamber represents a leak somewhere in your system. So you want to investigate it and figure out where it is. The purpose of a chest tube, we have our lung here. That is that little red area on the drawing. Then around the lung, we have a little protective layer called the visceral pleura. And then we have this small little space. And then around that space that attaches to our thoracic cavity is called the parietal pleura. And what happens is that whenever you breathe in and out, these two layers glide gently over each other. It'll be coming from the patient, and this tube right here is from the patient, and it's draining down into the drainage chamber. These are your drainage chamber where whatever's coming out of that lung is flowing down into there. Then in the middle, you have your water seal chamber, and there's blue water in this, and as the patient breathes in and breathes out, this water, sometimes there's a little ball in there that will move as well. And then you have an air leak monitor area, and in this area you are looking for bubbling, because if you see continuous bubbling, there could be an air leak. And then over here at the very end, you have your suction control chamber.
And these were some of the reminders on the day before the surgery, all written in Japanese, but all I could remember reading was inevitable pain.
It's not what you would expect to see in an operating room. There's minimal blood and no open incision, just a surgical team, a patient, and a TV.
VATS surgery is a minimally invasive lung surgery approach that stands for video-assisted thoracoscopic surgery, meaning we use a scope or a camera through a port, usually about a 5mm port, that goes in between the ribs, and we can do the surgery.
The surgeon operates by using a small camera through the incision while doing the same procedure he would do with a large open incision.
Because you're making smaller incisions and you're having less trauma to the body to get the same job done.
A VATS procedure is primarily used for lung operations.
You are at the table looking at a TV screen that shows the image inside the chest. Your hands or fingers are not in the chest at all, and you have special instruments that can reach in and do the job for you.
This is a standard camera and videoscope that we would use during thoracoscopic surgery. And once we place this inside of a patient's chest, we're able to then look up at the screen and see exactly what's going on inside of a patient. We can do less invasive surgery with causing less pain, less discomfort, with very good outcomes.
VATS can be used to remove excess fluid or air from around the lungs. The procedure offers quicker recovery time, less pain, and smaller scars.
The surgery lasted for about 2.5 hours. Then I woke up at the ICU with my husband telling me that everything turned out okay. I was off from the drain tube and shifted to the nebulizer. 3 days later, the doctor had allowed me to go back home. However, 3 years later, I had to be brought back to the hospital for a needle aspiration of my pneumothorax.
Needle decompression, where they stick a needle into that space and aspirate the air.
1 year later, I have become alive and well, enjoying the things that I never thought I would have been able to do.
Yeah. My knees are still shaking.
However, another year later, after my working day at the tourism college, I found myself in the hospital again. I just want to put emphasis on the fact that I tested negative for the dreaded coronavirus. From the 26th of June, I stayed in a private room all by myself, with only the hospital nurse, authorized staff, and the doctors coming into my room. Even my husband had to go through a strict routine checkup every time he came to visit me at the hospital. The hospital is never a happy place, and 16 days was a long time to spend doing nothing. So even while I was at the hospital, I was making test questions, checking my students' essays for their speech presentation, and updating my lesson plans. On the 3rd of July, my husband and I talked to Dr. Kushibe, the head respiratory surgeon of the hospital. He was the same doctor who did my video-assisted thoracoscopic surgery 5 years ago. That night before my surgery, I was not allowed to eat nor drink anything, with the exception of these. The OS1 jelly, an oral rehydration solution. The next day, Three and a half hours later, I woke up at the ICU again with the IV inserted at the back of my hand and the vacuum suction machine still at my left. After the anesthesia has worn off, the pain level has exceeded this scale. Four days later, I was finally allowed to go back home. Four more days later was the scheduled removal of the knotless, barbed sutures. If you ask me how it felt like, I'll leave that to your imagination. I just wish I'll never have to go through this again.